morning show on JTV. Today's show is brought to you by the Enchanted Forest Cafe, located on Ann Arbor Road. They have a brunch and Bloody Mary bar that is 8 to 3 p.m. every Sunday. Visit enchantedforest.com.
And as David Royce would say, it's a very fine Bloody Mary.
A very fine Bloody Mary, yes.
The Summit to Reduce Violence, second ever Summit to Reduce Violence, is coming up on Friday, April 21st at Jackson College. It'll start in the Dining Commons in Potter Center, continental breakfast program, guest speaker Dr. Chris Meldy from Michigan State, and then everyone will walk over to Burt Walker Hall for more of the programming, and then lunch. Everything is free, everyone is welcome. Be part of the Summit to Reduce Violence, Jackson County Prosecutor, Jackson County Sheriff, Jackson Police, Jackson College, and others working on this summit. Joining us now from the Jackson County Health Department, we have Health Officer Kristin Pluta and Deputy Health Officer Matthew Budd. Good morning.
Good morning.
Good morning.
Officers.
Thanks for having us.
Officers.
Officers. And Matt is also an RN.
Yes.
Yeah, I'm happy to be a nurse.
Yeah. And an expert and one of Matt's favorite topics to talk about.
Yeah, well, I think it's really important to talk about sexual health. I think that's probably the first place to start, right, is just normalizing that conversation so that way we can help people figure out how to be safer and how to protect themselves, especially if they might have an infection.
When did the term STD go from STD to STI?
Oh, I'm really happy you asked me about that. So both are still in existence.
Okay.
So the disease is, you might be able to, anyone who has an infection has an STD. The disease is just like those symptoms or those some type of effects from it, whereas the infection is you're infected with the actual virus or bacteria.
Until you said that, I thought STI sounded better. But
I don't think anything. No, I don't think that's a conversation which is better.
Last week was Public Health.
Either way, we can help with treatment.
Public Health Week last week.
Last week was Public Health Week, so National Week kind of highlighting, public health and all that it does. Last week, we do our stuff every day of the year, but it kind of just brings a light. It was on culture, so really talking about people. Some of the topics for the week of public health last week were things that we as a health department don't necessarily spend a lot of time on, but it really accentuates the, how broad public health can be. They had, there was STI, was like Wednesday last week to talk about sexually transmitted. They talked about nutrition, they talked about, community and things like that. But, so things that we do participate in and have, direct programs relating to, but they also, you just mentioned the Violence Summit, violence and the bigger picture of, all of the different social determinants of health and how that really, food insecurity and homelessness and poverty, how those, really do impact public health. And
this week with the beautiful weather, I think everyone has something on their mind about getting healthier. Maybe, because
maybe you tried shorts on for the first time.
Soaking up the vitamin D.
Yeah.
Absolutely.
And you're supposed to actually go out without sunscreen to get vitamin D for a little while.
Yeah, I don't know about the skin cancer risk and things like that, but I know 15 to 20 minutes is really good. If you're going to be out there for several hours, I believe still put on sunscreen, because then I don't really know.
Yeah.
But sunscreen is good overall.
Yeah, but to get a little vitamin D, the sun's the best source for that.
Yeah, it feels
I
good.
think up to your elbows for at least 15 or 20 minutes.
Yeah.
One thing that is nice about the health department is the partnerships that you guys have with the schools and getting young kids familiar with you guys very, very early. How important is it, the partnership with the schools that you guys have?
It's extremely important, and we partner with all the way down from in our SNAP Ed program down to the littles and preschools and the Head Start preschools, all the way up through our high school. Yeah. And we have multiple programs that work in different schools. So Our health resource advocates are doing, things with COVID and and expanding on COVID, but hand washing. I think we had a hand washing. They're doing that kind of thing in the schools. We were doing for Nutrition Month and Reading Month. Well, last month was Reading Month and Nutrition Month. Was it last month that was Nutrition Month?
Yeah.
But so we had not only in the libraries and in the schools doing, some reading about hand washing and good hygiene, but we had, our WIC area coming in and doing things like healthy eating and the picky eaters conversation, and
One thing that I don't think a lot of people know is the percentage of our county that might qualify for WIC. It's quite large, Matthew.
Yeah, it's very large. We have unusual about 6,000 to 6,500 individuals, so that's women and children, infants, on our program in any given year. But really close to about 50 to 60 to, I've even heard estimates up to about 70% of our population, pregnant moms and infants and children, are eligible for WIC benefits.
So there's assistance that clearly people aren't taking advantage of, or maybe don't know that they qualify for.
A lot of people think that they might not qualify, and a lot of the things we hear is they don't want to take away benefits that could go to somebody who needs it more. And the thing is, that's not going to be the case. So if you're eligible for benefits and you sign up with WIC, you're not taking away from somebody who might need it more. It's just a benefit that you're entitled to. And I also like it because it helps stimulate that local economy. Here in the summer, we even get booklets called Project Fresh. I think we talked about it last year, where families can take those booklets to farmers markets, and it's more fruits and vegetables from our local area. So it's a great way to help stimulate the economy here.
I think I just looked at the number for our WIC participants, the 6,500-ish that participate on an annual year. I think it was something like generates $2.7 million worth of money into our local economy at the grocery stores and farmers markets and everywhere where those are able to be used.
That's amazing.
So you mentioned STI, but there is a concern now in Jackson County because the incidence has increased on a couple of STIs. And we know that because you actually at the department do testing.
Right, yeah, we do a lot of testing at our department, and Henry Ford, Center for Family Health, do a lot of testing too. At the health department, we look at everyone who's tested positive, look at trends, and try to get a better understanding of what we can do. There is some good news. Chlamydia is down a little bit here in our community and across the state, but what we're seeing is a slight rise in gonorrhea and a rise in syphilis, which is really kind of outstanding because back closer to 2000 or so, syphilis was very rare, but now we're getting it a lot in heterosexual couples, a lot in pregnant mothers, and we've even had some cases of infants being born with syphilis, which was about unheard of 20 years ago.
Yeah, when you say rare, what was it like 20 years ago?
Just a few times in the U.S. per year.
Really?
Yeah.
Wow.
So double digits at least.
Wow.
So
Amazing.
Wow. What is expedited partner therapy?
I'm really glad you asked. So this is actually something that's very unique in healthcare and specific to public health. No place else you go into a doctor's office and you have a sore throat and they're like, here's antibiotics for your whole family. But at the sexual health clinic, if somebody comes in and they're screened positive for a sexually transmitted infection, and that individual might not want to come to our clinic to get screened too, we can actually send that individual home with antibiotics or call in a script to a pharmacy for that person to pick up antibiotics. That way we can help treat more people in the community that we know may have been exposed.
Right. Wow.
Yeah, people don't want to go in.
And of course, that's not something, people want to scream from the rooftops, right?
Oh, right. And we do it privately too. There's different phone apps and things like that where people can be texted from an anonymous number to say, hey, you might have come into contact with somebody with a sexually transmitted infection. Go pick up an antibiotic order or come see us for testing.
Oh, wow.
That's good to know. And like so many, everyone's health is their private matter, and do so many things to ensure that remains so. I remember all during COVID, things like the contact tracing.
Oh, gosh.
How confidential all of that had to be.
That's probably like a swear word in your...
I do a little bit of a flinching when you say contact tracing, but we still do it for other diseases, chicken pox, and we do a lot of contact tracing every time there's those lettuce outbreaks and things too.
Oh, yeah.
That's part of that same process.
I think it's important to note too that, you know, at the health department, in the sexual health clinic, that privacy is important, and it is something that we, you know, we will get. Someone who might not want to go to their doctor where they have a long-standing relationship with, but is a little more comfortable coming to the health department where, you know, these are more anonymous people that I might not have to see again. But, you know, when they come here, you know, their confidentiality, and that is, you know, of utmost importance because, you know, we want to be a place where you can come get treated. We can take care of this, but do it in a way that, you know, the individual isn't comfortable with, and, you know, we can use whatever measures we have for any, you know, partners.
How about younger people? Do they have to be accompanied by a parent? What's the age situation there?
If you're under 18, you do not need to be accompanied by a parent.
Okay.
So it's you know, screening. So if somebody hasn't told their parent maybe they're sexually active, they can still be screened to make sure they don't have an infection that's ongoing, and they can get treatment for it.
Well, with Public Health Week last week, if everyone did just one thing to improve their health, the whole county, imagine what a difference that would make.
For sure.
Yeah.
What are you going to do?
What?
On the spot. I absolutely love to walk my dogs. So you know, I get days like this, and even with even when it's chilly, but to get the extended, you know, light when the time changes, and I can actually go home and have, you know, a quick.
It's not a rush.
Yeah.
Matt, you going to do something?
Absolutely. Eat well, exercise, and get 8 hours of sleep.
Love it.
And you're going to start eating candy.
So much better than me.
I actually, you know what's
on a
funny?
list.
I tried candy last night. I gave up candy for lunch. Tried it again last night. I didn't like it.
Oh, wow.
That's a good thing.
It's
There you go.
unbelievable what has happened.
Matthew Budd and Kristin Pluta from the Jackson County Health Department. More of the morning show. Stay tuned.